I'm Sam, and today I just wanted to answer the question, what is the difference between bipolar and borderline personality disorder? If you have bipolar and you look at the list of traits in borderline personality disorder, you've probably related to these at some point during your journey with bipolar disorder. And if you've been diagnosed with borderline personality disorder, you probably look at the symptoms and you can relate to that as well. There is some overlap, and because of this, a lot of people get confused, have got these sort of symptoms, and a lot of psychiatrists sadly get confused as well, and it causes a lot of problems. There's a lot of research out there which shows that misdiagnosing these two as each other is really harmful for the clients. So I just wanted to clear out some misconceptions that there are and present the facts about both disorders. Firstly, to be able to spot the difference, we have to understand what mood is and what emotion is. So moods are long in duration, they last for days or weeks, and they lower the threshold for certain emotions. So for example, if you are manic or if you're in a high mood, then you're more likely to get excitable, you're more likely to get angry, you're more likely to feel intense happiness. Whereas if you are in a low mood, you're more likely to experience the emotions of sadness, shame, and guilt. In contrast, an emotion is a very short-lived experience, maybe a couple of seconds or a couple of minutes, maybe maximum like 30 minutes or so. So they're very short in duration. The current mood that you're in generally makes it easier for you to have certain emotions. Emotions are also triggered by situations for the most part. So either internal situations, so for example, it could be a thought, it could be something that you're feeling internally, like you're feeling sick in the stomach, and that might trigger an emotion. Or it's generally external triggers. So, something's happening in your life socially, or, you hear about something happening in someone else's life and it triggers an emotional response. Bipolar disorder is a mood disorder. So it's characterized by highs of mania and lows of depression. This video isn't really going in depth into what bipolar and borderline is. It's just sort of highlighting the differences. But essentially, you feel elated, you feel high, you feel incredibly irritable often at the same time, you struggle to sleep. You talk very fast, generally a grandiose sense of self, and this level of highness experienced in bipolar can also be quite painful. In periods of depression, you feel very low, you feel very depressed, you move a lot slower, talk a lot slower, you see no point in life. There are sometimes mixed episodes which you experience both mania and depression at the same time, but that's quite rare. And then you have periods of stability as well. So like I said, moods last for quite a long time, and the thing is, so do bipolar episodes. So a manic episode, in my case, it lasts roughly 3 months, and a depressive episode will last roughly 6 months. When I was suffering from bipolar disorder, to meet diagnosis for an episode of mania, it has to last at least 1 week, and depression 2 weeks. But often they are longer, like how my episodes were. As you can see, bipolar disorder in nature is very inconsistent. So the way that you are over time is very inconsistent because you're having these highs and lows over long periods of time like this. And that's what makes bipolar an episodic illness and a mood disorder. Borderline personality disorder, on the other hand, is a personality disorder. And personality disorders in nature are actually very consistent. So the definition of a personality disorder is a rigid set of symptoms or traits which are the same across time and across situations. So essentially, these traits are going to start maybe 15, 16, maybe even earlier, maybe slightly later. And these are going to be consistent throughout probably the life course. Sometimes it sort of wanes somewhat by like the 40s or 50s, or if they've got treatment, then thankfully they manage to get over these sorts of symptoms and these sorts of feelings, which is great. But for the most part, it tends to be very consistent over time. Also, as I said, it's also across situations. So whether you are in the country park, whether you're at the gym, whether you're at work, whether you're in your relationship, whether you're at home with your family, these traits are going to be consistent in all of these different situations. This is a really important thing to understand in general in terms of personality disorders, because we might all exhibit some traits of personality disorders in some situations. Like for example, with borderline personality disorder, if we're at the end of a relationship or going through a really difficult time with our partner, just with our partner, we might have some borderline traits. but that's not going to be consistent across time and across situations. Whereas to be diagnosed with a personality disorder, it has to be consistent across time and across situations. So people with borderline personality disorder are actually generally viewed as very inconsistent. Like, for example, you know, they might change their hair color very often, or they might change the way that they dress. And this is because of identity issues. So issues with knowing who they are and with their identity. I guess there is this unpredictability in that type of way, but it's almost like it's a predictable sense of unpredictability because these identity crises are like consistent across time. So are the emotional swings. People with borderline personality disorder, they might be in quite a neutral mood, but situations that are happening either internally or generally interpersonally are going to have more of an effect in terms of their emotional response. So even if someone with borderline is in a relatively neutral mood, feeling pretty stable, they're going to experience these intense emotional swings which are going to impact on how they feel and also their interpersonal relationships. I hate the view that some people have that people with borderline are just difficult people. It's nothing like that at all. People that are suffering from this disorder are often given a lot of bad treatment, and I find that really sad. But it mainly boils down to unhealthy attachments earlier on in life, and sometimes it's genetic, but for the most part it is due to trauma, abuse, neglect, and all of these types of things which lead them to really struggle in their attachments and create a fear of abandonment, which they need to develop again. And they can definitely live fulfilled lives later on. They just need to persist with treatment and be able to find that sense of self. It's incredibly important to understand the differences between the two because of how different the courses of treatment are. So in bipolar disorder, it's incredibly important to be on medication, generally antipsychotics or mood stabilizers, to be able to get that level state. Because regardless of whether it's a genetic predisposition that has caused you to have bipolar disorder or life experiences, it's caused a chemical imbalance in the brain which needs to be stabilized. And people, if once they find the right medication, they end up in a state of stability. In deep contrast, people with borderline personality disorder don't tend to respond well to medication, and DBT or attachment-based therapies can help people to be able to form healthy attachments, live happy lives without black and white thinking, and able to have more of a sense of self. There are many cases where people have both borderline personality disorder and bipolar disorder, and as you can imagine, this is incredibly challenging for these people. Because not only are they having these extreme highs and extreme lows, but within each, and even within periods of stability, there is also this sense of questioning the identity and extreme reactions to certain situations, which exemplifies what is being experienced within bipolar disorder within this period, and also leads people to not be able to live happily within stable periods either. So the course of treatment with this would generally be a mixture of treatments for bipolar disorder, so that would be mainly medication, some psychotherapy, and also DBT, so dialectical behavioral therapy. So I hope that this video has been informative and helps you understand a bit about the difference between bipolar and borderline personality disorder. Essentially, bipolar has categorical episodes of illness where moods are either persistently high or for a few weeks or months, and then persistently low for a few weeks or months, and then periods of stability, whereas borderline is a personality disorder which involves primarily attachment-based and abandonment-based issues and identity crises, and viewing life from a very black and white angle, due to problems with attachment earlier on in life and extreme emotional reactivity to situations. I've just written a book on bipolar disorder. It's called Winning the War with Bipolar. I've got bipolar myself, and I'm just embarking on a PhD within cognitive remediation therapy for bipolar. So yeah, check out when that book comes out. I'm going to put it in the link below once it can be pre-ordered, because it's got a lot of information in there which can help people to be able to understand the techniques and the strategies needed to be able to manage bipolar.